Sometimes kids go to pediatricians and they have fever 5, 6 days. They get sometimes glands in the neck. Looks like someone put lipstick on their face.
Yeah.
The eyes are red, and they don't discharge. And the pediatrician is saying to the parent, we have to do a very, very careful workup.
Yeah.
And
Okay.
why? What's that all
Okay,
about?
and now, so what you're referring to is Kawasaki syndrome. This is named after Dr. Kawasaki in Japan, who in the late 60s noticed a number of patients in Japan who died after having a febrile illness. And they went back and they looked at the records on these kids. And they eventually came up with some criteria for what is called Kawasaki syndrome. And probably the one criteria that almost all of them have is fever for at least 5 days. And then you mentioned the eyes having conjunctivitis, but yet not having a discharge. And you mentioned the lips being cracked, and often the tongue will be red, and a mucositis, where the whole mouth will appear red. You mentioned the lymph nodes, usually they're at least 1.5 centimeters. They will often have a rash. And that can be in various parts of the body, or usually include the inguinal area. The last criteria are the hands. Well, the hands will look erythematous. Okay, and then maybe a week or two later, the tips of the fingers will begin to peel. Now, to make the diagnosis, we say that you should have the fever for at least 5 days, and then 4 out of the other 5 criteria. But unfortunately, not all the patients read the book, and which is a problem. So we have some kids who have fever, and there was a large paper published in December of 2004 by a task force that came up with the term incomplete Kawasaki syndrome. You have a patient who has fever for 4, 5, 6, 7 days, and you don't have another cause for it. And they have some of the criteria, and these are the patients who you're going to worry about. Then you'll ask for a cardiology consult and ask if they get an echocardiogram.
Right, if that diagnosis is suspected or maybe proven, what can a doctor do so you don't have a problem or less likely have a problem?
Well, and what we can do for it is we can give something to then decrease this inflammation. We give a medication called gamma globulin, and we also give them aspirin, and the idea is that we're trying to decrease the inflammation. And what we're trying to do is prevent problems with the blood vessels in the body. What I didn't tell you before is that what does happen with Kawasaki's eventually is that it affects all the blood vessels in the body. And again, it gives them an inflammatory process, where the body begins to weaken the blood vessels, or actually almost like to break them down because the body thinks it's foreign. And then the body will begin to repair them. Now, in most parts of the body, it doesn't make a big deal of difference. You have lots of blood vessels in various parts of the body. But what it really makes a big deal of difference are the coronary arteries. Those are the arteries that feed blood to the heart itself. And they're not very large. And when those blood vessels get inflamed, they then can, when they heal, they can heal with stenosis, or just from the healing process and the scarring tissue, you end up getting narrowing within those blood vessels, and unfortunately, what that can lead to are a couple of things. One, you have the narrowings itself that don't allow enough blood flow to go to various parts of the body. Okay, but then it can also lead to areas where you can form clots. And and unfortunately, when Dr. Kawasaki, had autopsy done on these patients, this is some of the things that they found.
Is it worse or better when a child is under 2 or over 2?
In fact, it is worse under 2. It's harder to diagnose. Those kids are more common to have the incomplete form, where they may not have all the symptoms of Kawasaki syndrome, and yet we have to think of it and treat them.
Can Kawasaki almost look to some people almost like a thing called scarlet fever?
When you think about it, it can have some of the same symptoms, certainly with the fever, and the rash can sometimes be confusing. Although, with scarlet fever, you get like more of a sandpapery rash. But absolutely, these things are often confusing. You got to think of them.
So sometimes it's not an easy diagnosis.
Very tough.
But many times we're not sure. We always get a pediatric cardiologist involved.
Yeah, so that, because it can be difficult, we will actually, have, the patient seen. If they're having fever for a few days and we're not sure, we will then start the process. Have them seen, get the echocardiogram initially. Okay, if we find out it's scarlet fever later, that's okay. Even if we find out, it can mean many other diseases, many other rheumatologic diseases. Still, we just need to start the process.
Thank you.